You've landed at the edge of what medicine has known and what it's becoming. I'm Dr. Richard Rocker, and this is the Integrative Continuum, a podcast bridging biology, energy, and human potential. In each episode, we explore how quantum biology, frequency medicine, and ancient healing systems are transforming our understanding of health. This is where mitochondria meet meaning and blood work meets bioenergetics. Subscribe now and join me on the frontier of integrative healing, where science and soul are no longer separate. Welcome to the Integrative Continuum podcast, where we explore the science, philosophy, and future of truly holistic medicine, bridging functional, integrative, and quantum health. I'm your host, Dr. Richard Rocker, and today we're diving into a topic that challenges one of the biggest myths in modern nutrition, the idea that all plant foods are inherently healthy. My guest today is Sally Norton, author of the groundbreaking book, Toxic Superfoods, How Oxalate Overload is Making You Sick and How to Get Better. Sally has a background in nutrition science from Cornell University and a master's in public health from the University of North Carolina. Her work has brought to light a long overlooked issue, the hidden toxicity of oxalates found in many of our so-called superfoods. If you've ever wondered why eating spinach, almonds, or sweet potatoes might not be serving your health, or why so many people feel better when they cut back on certain plant foods, this conversation will open your eyes. Today we'll explore what oxalates are and how they quietly damage cells, why the superfood narrative is misleading, how to safely transition to a low oxalate lifestyle, and how this knowledge fits into functional and integrative medicine as a missing link for energy, inflammation, and recovery. Sally, it's such a pleasure to have you here today. Welcome to the Integrative Continuum.
Oh, it's a pleasure to be with you, and that is one of the finest introductions I've ever had. Thank you.
Oh, thank you. Okay, Sally. So let's start with your own story. You had a strong background in nutrition, yet your own health struggles led you to reevaluate everything you've been taught. What was the turning point that made you realize superfoods could actually be toxic?
One of these evenings, ruminating in my bed about why the heck this arthritis has come back, why I'm getting stiffer and stiffer, why I'm aging at a rate that must be some super crazy thing. I'm laying in bed and recognizing that a lifetime of arthritis is connected to my eating of healthy vegetables, like things like Swiss chard, which I grew up growing. And I just couldn't even put words to it. And I still cannot. The feeling of shock that the things I've been trusting were actually the enemy all along and I could never see it was, yes, you pause and you pivot, and not everyone pivots with you, but your life experience will lead you into opening your eyes to seeing things you didn't see. So that was uh, in 2013, after I had learned a few years before about oxalate causing pelvic problems through the Vulvar Pain Foundation. So there's in North Carolina, here in the US, there's a Vulvar Pain Foundation who for about 32 years now have been educating people with various pelvic syndromes, particularly women with, vulvodynia, that if they change their diets and get oxalates out of their diet, that they can recover from this unrecoverable condition. And I had never heard any of that in school. In school, we learned that oxalate takes calcium away from foods that you're eating and lowers the amount of calcium you can get out of foods. It potentially can affect calcium in the body and certainly can form as kidney stones in the kidneys. And so people with urinary tract problems have to be put on a low oxalate diet, which I thought was this niche thing for a particular patient population. And basically you don't have too much oxalate or tea or tannins and oxalate with or near meals, or make up for it with more calcium. And by the way, have more yogurt. Like that was about it that we learned in school. So I had thought I knew a little bit. The more you think you know something, the less educable you are. And so it makes it even harder to have this get through the thick brain. But once you've seen it and lived it, that's a whole nother level of knowledge.
Yeah, well, personal experience is a big one. And I think that's why a lot of us get into various aspects of health and wellness. And some of the best people I've seen in the industry never started off in health. They started off as like engineers or that, and then they had a health issue and they tried to figure out why that's happening, and boom. So just like what you're finding. So, okay, so we're talking about oxalates. So a lot of people out there, they're still very unaware of what oxalates are. So can you tell us what oxalates are and why have they been largely ignored by the mainstream media?
Right. So oxalates are called oxalates plural because this chemical called oxalic acid forms different compounds with minerals and becomes what we call a salt in chemistry. So it can form something like calcium oxalate, which is the most common form you see in nature. And that's interesting because plants make oxalic acid so they can build oxalic acid plus calcium, build crystals with that. They deliberately build the crystals for all kinds of purposes, and they use oxalic acid in their various means of survival and self defense. And so when you eat this thing that grabs calcium, magnesium, copper, any kind of mineral you want, it can grab. It can affect the electrolytes, it can affect nutrient absorption of minerals, and fundamentally, when you start changing the electrolytes in your bloodstream around your cells, it changes their ability to function properly and turns on a lot of cell damage. There's other ways it's causing damage, but this oxalic acid is a two-carbon molecule. It's very small. It has four oxygens on it, which is a crazy ratio of oxygen to calcium. And it's so powerful in its ability to be a bleach and a mineral chelator that we use it in cleaners, and we have since the 1700s. So Barkeeper's Friend powder has oxalic acid in it, and that's why it can help you get the rust out of your sink. You can use oxalic acid to remove rust from an engine. They do it all the time. You can bleach wood with it. It's a toxic chemical with a big skull and crossbones on it that you can use with gloves as a cleaner, but you can also just go ahead and eat a lot of spinach, Swiss chard, almonds, sweet potatoes, the things you mentioned, quinoa, raspberries, kiwi, things we trust as food have this chemical in them that can start literally cleaning out your system of minerals and make you mineral deficient, electrolyte imbalanced, turn on cell membrane damage, wreck the way mitochondria work. So it's good for plants, not so good for us. And so, wait a minute. What if plants aren't actually meant to be eaten? What if they actually are somewhat toxic to us? That's a thought bubble. Like, hey, wait a minute. Most plants in your yard out in nature you would not eat. You wouldn't. You have to go to a produce department to find plants. So that in itself should open up our thinking to realize that concept you mentioned earlier, that our myth that all plants are safe to eat in any quantity is proven to be a myth when you start studying the oxalic acid chemistry and what literally your diet that you think is normal, full of potatoes, which is another high oxalate food, peanuts and chocolate, basic foods we start eating in childhood can be causing problems that can lead to bigger problems over time.
Yeah, it's interesting when you look at the chemistry, the biochemistry of things. One of the things that I do is I specialize in blood work, so blood biochemistry. And after a while of working with bloods, you kind of get to look at different types of people and you see what diets they have. And one thing that always led me to question more what could be going on is how come when I worked with people that had primarily plant-based diets, why they always tend to have really low levels of nutrients. They all seem to be anemic. They seem to have a lot of gut issues and problems. And from what you've just said there, that really ties into that, doesn't it?
Oh, it does. In fact, anemia is a kind of standard problem with oxalate poisoning, and it's anemia you cannot treat. And it makes sense because given its propensity to connect with calcium, coming in from your diet gets into your bloodstream and not just staying in the blood, it gets pushed into the tissues and the capillary beds and ends up ultimately in bony tissues, especially the bone marrow and the teeth and the jaw. Well, the bone marrow is where your cells are born. So what happens with oxalate poisoning in the bone marrow is that the cells get released from the bone marrow immature. So you're sending eighth graders out for a career before they're ready. And then you're adding more oxalate to the blood after every meal and damaging those cells. And they die early. You end up with a loss of minerals and problems with cell turnover. Some people have low white counts too. So they'll have anemia, low white counts. And you'll see some of that in the symptom pattern where there's fatigue, Digestive problems have long been considered the standard a piece of the diagnostic picture for oxalate poisoning since 1842. So you asked earlier, why has this disappeared? This conversation about oxalate, it was a big conversation in the mid 1800s and was a possible diagnosis of dietary oxalate poisoning was a diagnosis until we got into blood work. Ironically, you can see it in the blood if you go on to look at it under the microscope and really look at the clinical picture of the person and see there's something off. But in the kind of things we measure now in the chemistry of blood work, those factors the body will keep as perfect as it can. It will sacrifice other tissues, your bones and bone marrow, and other tissues in order to maintain the proper blood chemistry. So it's interesting and ironic to hear you say when you actually look at blood, put it under microscope and really see what's happening there versus run a test and read a test and say you look fine. That's a huge shift in our mindset in medicine and how to even notice this is going on because unfortunately, like many diseases, you can be silently poisoning yourself with foods you think are fine and have very little outward signs of it.
Yeah, yeah, absolutely. Um, Another clinical observation I've made, people that have a lot of inflammatory problems, and I see it often with people with a lot of mysterious body aches and pains, arthritis, and maybe fibromyalgia and various types like that. In my own experience working with them, when I start to reduce the amount of plant chemicals, obviously including oxalates as one of the major ones, I always seem to see that they start to improve. So how does your research connect with that kind of modern chronic illness like fatigue, inflammation, autoimmune conditions? How does that all fit in?
And that whole achy picture of the rheumatism and the arthritis and tendonitis and bursitis and all that.
Yeah.
Yeah, and you're not the only one. There's a plenty of chiropractors and other clinicians out there who are like, How is it that people who eat so healthy always end up with arthritis and these problems?" Well, the mechanism of toxicity with oxalic acid is fascinating because there's like 6 or 7 or more ways in which it's causing toxic effects on the body. So you have that, what we already talked about with the electrolyte imbalance and really the stealing of essential electrolytes from the body, especially calcium, but also magnesium, the loss of potassium and all that. That just mucks up the works. I mean, having a calcium problem in the blood will cause arrhythmias and heart problems, but then the reason the calcium's getting lower in the blood is because oxalic acid is stealing calcium, and that calcium oxalate can precipitate out, and it tends to get pushed into the capillaries or form in tissues in a way where you can have enough of it there that they pair up and start forming crystals. So they move from being a dissolved molecule into crystal form, and those crystals get hung up in tissues, particularly in tissues that are reproducing, because those new cells aren't able to protect themselves and really rebuff it. Anywhere where there's tissue injury, where there's, vacuoles and little debris from dying cells, it just sticks there. There's not enough living material to do something about it. Where you have infection and inflammation, all those kinds of areas are going to be prone. Also, the bones and the calcified areas where there's less cells, the tendons, there's less cells there, so there's less defense. This sort of semi non-living material in the body will just be a sitting duck for this accumulation. So now you're forming crystalline particulate pollution throughout the body. This can happen in the brain, the meninges, the eyes, the thyroid gland, the bones, the kidneys. Those are all the most common tissues where you'll find it. Also, the teeth and jaw, and probably your glands. So your pancreas, your adrenals, your thyroid gland, etc. Now, this is a real big deal. If you have crystalline particulate pollution all over your joints, inside your joints, in your tendons, around your nervous system, this is asking the immune system to deal with it. And the immune system will do its best to kind of wall it off. Sometimes these little granulomas form or nets form. These are ways of kind of packaging the crystals so that their electromagnetic and other types of damaging principles they kind of admit being there will be contained. So the body will contain it. I think it's similar to how the body contains tattoo ink. So with tattoos, you would think, why doesn't it just grow out? I mean, doesn't the cells and the the cells of the skin just move to the surface and push out junk and detox for us. The skin's the biggest organ. Why doesn't the skin get rid of that tattoo ink? Why is it there forever? That's the immune system busy holding each little micro droplet of ink inside a monocyte that's there containing the toxicity of that toxic material, allowing your body to tolerate it. So there's a lot of work in the background with the immune system. And sometimes those crystals get too big and are way too much for the immune system, and they become a constant irritant that will turn on inflammation and create inflammatory problems where you overwork the immune system and ultimately develop autoimmune type problems.
Wow. Yeah. So it's a big whole inflammatory cascade then. Yeah. So
That you're stuck in, because now you've spent a lifetime peanut buttering and eating dark chocolate and so on, and now you've got crystals that are there that the body is having a hard time managing, and you create a chronic disease, a chronic toxicity that's quite dangerous to your aging and your immune well-being. And it's interrupting tissue integrity. The structure of your bones and teeth and your tendons is going to be compromised.
so if it's affecting all of that, then obviously it's affecting us on a smaller level on a cellular basis.
And that's really the scary part, because what you end up with is a brownout condition in the cells, because it's interfering with how the cell works and interfering with mitochondria being able to generate enough ATP energy to run the cell's business. So the cells are running on brownout level energy or worse. And that is basically the principle of aging, because now the cells can't reproduce fast enough and you can't maintain the tissue integrity, and you end up with fibrosis occurring to kind of hold things together. So what will happen is the fibrotic cells will keep working while the normal cells are struggling to maintain their integrity.
So this would obviously have a part in the huge increase of metabolic issues that we have in this day and age.
It's amazing. I've had several clients, one in particular who was on metformin for diabetes until she went on low oxalate, and now she's not diabetic, except when she can tell that the body's expelling oxalate from her tissues. When it comes back out of the tissues, back into the bloodstream, the diabetes returns. So there's more than just permanent damage to the islet cells and your ability to produce insulin and how well the pancreas is working, but how the whole system that manages your blood chemistry is being interrupted by the oxalate and all its toxic effects.
Yeah. So you just mentioned oxalates getting into the bloodstream. So in your book, you mention dumping. So what exactly is oxalate dumping, and how can we support people through that?
So there's that, build up over time. We're all harboring a certain amount of oxalate in our thyroid gland and other tissues, like we said. And now once your blood chemistry is lower in oxalate because you quit eating it. So after each meal, there's a period of 8 to 10 hours of elevated oxalate in the bloodstream that peaks at about 4 hours after the meal. And the body, while that's happening, the body has nothing better to do with what's storing in the tissues and hold on to it. But once you stop loading up the bloodstream from external sources from your diet, that gives the body an opportunity, once the kidneys are ready to handle it, because sometimes we've filled up our kidneys with a condition called nephrocalcinosis, or worse, we're getting kidney stones. So the kidneys need to recover first because they're the major exit route, but not the only one. So the tissues are going to do their best to finally get rid of the garbage they've been holding on to in order to just keep you alive. And that's kind of tricky, because you're breaking down crystals, which is a lot of work. It takes energy, it takes inflammation. So that process can cause symptoms. In fact, the symptoms on the body's attempt to take this stuff out of the tissues is going to develop more symptoms or generate more symptoms than the process of sequestering it and holding on to it as it came in. So sometimes getting better, you feel worse than you did when you were causing the problem. So that's an important thing to understand, though, because it gives us actually a mechanism, a way to sort of medicate with oxalate to tell the body to not overwork on this deep desire to clean out the tissues. So you can get yourself into a situation where there's systemic cytokines, a whole systemic chemical call for action, kind of like the authorities turn on all the alarms at all the firehouses and said, send all your ambulances, all your fire trucks out. And there's a woo, woo, woo. And so there's all this high alert chemistry that can affect all the tissues. And you can suddenly get a whole systemic system where too many tissues are in this idea that they got to rescue the tissues from this oxalate and start throwing it around. And that's bad because you have too much release of oxalic acid. Suddenly you're repoisoning yourself from inside. And then when it gets in the bloodstream, you get hypocalcemia. And that means you're dropping the calcium levels suddenly. That'll turn on the process of taking calcium out of your bones, right? So the parathyroid glands, give them some time, and eventually they'll tell the bones, hey, start drilling holes, start releasing calcium. We're out of calcium. We need calcium. And so then you get waves up and down with calcium levels in the blood in ways that can cause the pacemaker to start failing. You can get arrhythmias, hypertension, and you can get these weird attacks that are quite scary. They look like a heart attack or stroke. And if it's bad enough, if your system is so spent that it can't recover quickly enough, you could literally have heart block, which is a form of death by heart attack because of hypocalcemia. So you don't want to do that. That whole like over enthusiastic attempt to remove oxalate at one time is often referred to as dumping. It's kind of what I call a clearing crisis, where the body's trying to clear it out in a way that's causing a overall toxic crisis, and we have to manage that. So first thing you do is get enough calcium to correct that hypocalcemia. Run to take some calcium, take some lemon juice or other forms of alkalizing. You can put baking soda in lemon juice, make an alkalizing drink, take calcium, and do that as often as you need until the symptoms calm down. And then when you get a chance, 2 hours away from the calcium, you can eat some oxalate, have a double strength cup of tea, a small portion of sweet potatoes, a glass of beet juice, some dark chocolate, something with oxalate in it will tell the body, hey, this is not a good time. See, we're eating it now. We're eating it now. The body's smart. It knows about oxalate. It's not really happy about having to hold on to it, wants to get rid of it, but it won't keep doing that if you tell it, hey, you can't because I'm eating it again. So we can use oxalic acid in the form of these foods that hurt us to begin with, strategically, wisely as a medication. So we turn them from food into a medication in order to manage that if you get into a clearing crisis.
Wow, that's very interesting. Um, some signs, excuse me, some signs that I've noticed with working with patients, and maybe you can add some more. I've noticed when we put people on low oxalate diets, I often will get a call and they go, I think I have a kidney infection because I have a real strong, burning kind of urination. And I said, well, I think you're just doing an oxalate dump. Let's just wait a day or two. And I said, it'd probably be fine. And it always is. So I tell people it's like oxalates are like little shards of glass coming out, and it's not going to feel great. One other thing I've noticed is people tend to get various skin eruptions. And one common thing I've heard from plenty of people is they get these like little white bumps they think is a pimple, but when they try to pop it, not being gross, they go, nothing ever comes out of it. So have you seen those things yourself? And are there any others that people can look at?
Absolutely. There's that skin eruption thing. I never had it. So people came to me and they're like, look, I've got all these crystals in my nail beds coming out, all 10 nails, and the skin is peeling and it's all high drama. I'm like, oh, that's interesting. And then more and more people, I spoke in Ottawa one year, I think it was 2018 at a keto conference. And one woman listened to me, followed the advice. And I heard from her a couple weeks later, she had kind of tiny red blisters break out mostly on her legs all over. And each one was putting out a little bit of quartz like grit. And one of them was just a big, like a rice grain, only very much looks like rock candy. Remember rock candy with
Yeah.
all raggedy edges, but the size of a rice grain, like big junk being pushed out. I've had other people say they snow, like they're literally, it's a white dust coming off. One woman for 3 years, she said she would have a shovel full of white dust in her sheets every single morning. So it can show up on the skin in all kinds of ways. You can even just in the beginning, you might get a heat rash, a raised red, bumpy rash. That's a sign of the immune system coming on. A burning can be the immune system irritating the nerves, and that could be the immune system's reaction to the tissue damage, the electrolyte problems, or just the fact that the neurotoxicity of oxalic acid causes nerves to suddenly stay on and they're buzzing, and they could just be buzzing because their electrolytes are messed up. So there's lots of different mechanisms. But yeah, the skin thing is very interesting. So there's the urinary tract that will release cloudy urine, burning urine. You definitely need to take lemon juice to help dissolve those crystals. You can make kidney stones and kidney grit. much easier and softer to release and pain-free. You can get rid of kidney junk, oxalate junk with lemon juice. There's the skin, there's the digestive tract. So some people are good at transporting that oxalate out of the blood into the colon. If there's enough calcium in the colon because you've been taking supplements and eating cheese, it'll hold it. And you can, at times during these clearing crises, you might be releasing in the feces this like sandy, gritty, scratchy stuff. And you look at it and you can see these little sandy things that might be tan, like the color of a sesame seed, or black, or both, or white, and feel the grittiness. You get burning, hemorrhoids, those kinds of things. So there's urinary tract symptoms, there's digestive tract symptoms, there's the skin symptoms, there's eyes. Your eyes might be extra crusty in the morning. My eyelids used to be glued together with crust in the morning, and you get like some white grit stuck to your face here. Often that's happening overnight, because overnight is when the body does this housekeeping and will more likely be in the clearing metabolism overnight. So you might find it in the morning. Another thing you might notice in the morning is extra tartar on your teeth. So you can look at the back of your lower incisors and inspect them for how much tartar is there. That's a sign that your blood oxalate has been elevated. So if you have a history of a lot of tartar and going to the dentist more often than most people, that's already a sign that your diet's been too high in oxalate, and it may come back in these waves as your body's dealing with oxalic acid in the bloodstream.
Yeah, I've noticed that myself when I started making the dietary changes, reducing the amount of plant foods and preparing them in a different way that, yeah, the back of the teeth, I always used to feel it was a little bit rough. Now it's smooth as anything, and it's really great. My dentist always keeps wondering why my teeth are so good, and I only come in every 5 to 7 years. And I think it's, obviously what we do and what we expose ourselves to. The eyes as well, makes a lot of sense. I used to have a lot of eye sand as well, and that don't have that anymore, which is really interesting. But if could that affect people's vision as well these days? Because it seems a lot of people are having vision issues. I know computers are probably one aspect of that, but would oxalates affect the eyes as well?
Eyes are probably affected as much as kidneys, or more. As much as the bone marrow, the kidneys, eyes are right up there. The thyroid gland, all of them. The thyroid problems we're seeing, huge issue. Eyes, a lot of us are getting night vision problems, can't drive by the time we're 40. That goes away for most of us with low oxalate diet. Cataracts, I've had a handful of people completely reverse their cataracts, which is really just inflammatory distress in the lens. And oxalate very much affects the eyes for many reasons. One of them is because the eyes and the fluids and the glands around the eyes is the surface of the brain, and the cerebral spinal fluid is probably sending gunk toward the eyes because the eyes is an excretion route. And so I think we see this coming on and off. I got eye styes after I got off oxalate because there was so much gunk coming out through the glands around the eyes. They would get clogged with the gunk and get infected. And that's easy to handle, though. You use not a toothpick, but a Q-tip, and use some coconut oil and put that on the eyelids, especially at night, and that'll help dissolve that sebum and the gunk and help it come out, and also has anti-infection, antibacterial effects, so it helps you deal with that. But we have to realize, like, the eyes and oxalate are a big thing. Unfortunately, the world of ophthalmology hasn't caught on to this. And most of my clients who go to their eye doctor and say, look at these calcium crystals that came out of my eyes. I'm like, yeah, don't worry about it. That's just some old calcium. Who cares? So they haven't quite woken up to this, but I am convinced now that the reason I needed glasses in 10th grade and why I needed bifocals in junior year in college is because of my lifelong high oxalate diet. And I was so happy that my night vision got better. My vision is just stabilized now. But back to the oral health too. I had all these cavities and tartar and problems, and it was got a crack in my tooth, and was told I was going to need a cap. And then I went low oxalate, did a bunch of lemons every day, and I haven't had a cavity since. My teeth are good. The doctor's like, your enamel is excellent. The gums are happier. They stopped worrying about my gums getting worse. It's really nice to have your face come back, like being able to see and have your teeth. And my sinuses, I used to get sinus infections every single year for about 33 years until I went on this diet. And then I had facial pain. That was my first area that I could tell some inflammation was occurring. which is part of this healing process, had really intense face pain in the evenings and trying to go to bed. I felt it was like, this must be what a migraine is like, but in the face. It was so bad. And now I haven't had a sinus infection in 12 years.
Fantastic. Excellent. So a lot of we mentioned oxalate dumping, and we hear a lot about detox programs these days. How is the success of a detox program if oxalate overload isn't really addressed?
Oh, it's not gonna be good. For one thing, if you're trying to force heavy metals out, you're already toxic with oxalate. Oxalates are probably holding heavy metals, and the whole process of the body releasing oxalate could stir up and release mercury, aluminum, who knows what other junk we have in our system, thallium, there's a lot of stuff that's not great. So, what is detox doing but insisting that the liver is coughing up more bile and flushing things out? But the chances of you having liver problems from oxalate from your diet is quite high because the way the circulation works from your digestive tract is that the things like oxalic acid and nutrients that you and bacteria, whatever, that gets into your bloodstream from your food are directly and immediately shunted to the liver. This is called hepatic circulation, right? So the liver gets 100% of all the oxalate you eat that gets into your bloodstream, which if you have a really great gut, it's only 10 or 15% of the oxalate you're eating goes straight into the blood, messing up those white blood cells and the red cells and getting straight to the liver. And now the liver is overworking with its glutathione to protect itself from the damage from the oxalate. And what the liver does with all that oxalate is make more. Inflammatory stress causes the liver to make more oxalate. The liver produces about 12 milligrams of oxalate a day. It doesn't detox oxalate, it makes it. So don't think that if you help your liver, you're going to somehow detox oxalate. You're not. You're just going to stir up the fact that the liver is probably loaded with these lipid crystals of oxalate, and eventually the liver will try to heal as well because the liver is known to be able to regenerate itself. But the idea of telling the liver what to do when the poor liver is doing its best to cope with your high oxalate diet is probably a bad combination. So I would first stop poisoning my liver, give my liver a couple years to kind of recover, support the gallbladder, know that the gallbladder sludge that can lead to stones is a lot of it is oxalate coming from the liver. So you're going to want to support the gallbladder in recovering from oxalate overload and just your whole system. Let your kidneys recover, give them a year or two, give your liver a couple years. Like let your system regain its well-being from the oxalate poisoning. And the body's ability to detox pretty much is innate. Us pushing on it and trying to tell it what to do when it is not necessarily as helpful as we want to believe.
Here's an interesting, just a thought that came to my mind. If would oxalate content in foods be increasing if it's a protective mechanism for the plant? And if the plants are under more stress these days because the environment is more messed up and more pollutants in that, could the oxalate content actually increase from, let's say, what it was 100 years ago?
Yeah, the growing conditions are going to affect the plant's need to make or ability to make oxalate. And for example, there's studied in tomatoes because too much oxalate causes tomatoes to put oxalate crystals in the top of the fruit and the curved top where they call it the shoulder of the fruit. And then they can't sell those tomatoes because the cells break down and they spoil quickly. So that's caused by high calcium soils and high humidity. That's the two factors that most likely cause overproduction of oxalate in the tomato plant. Um, and one of the things is all this engineering and changing of varieties, because each variety of plant will have a tendency to produce certain amounts. So there's a variable we haven't studied. There's not a lot of money in botany, particularly on this particular topic. So it's very limited the amount of research we have on this. But I think when there's a lot of fungal pressure, there's higher oxalate production because the plants turn oxalic acid into hydrogen peroxide in order to fight funguses. So if there's a lot of humidity and fungal pressure, um, and probably changes in daylight that are odd, like a really cloudy year might require more oxalate or something like that. There's lots of different factors we haven't really considered. But I do think that it's possible that plants that are given pesticides and things have less oxalate than the ones that aren't, but we don't know.
Yeah, I think it
Because
would make
you
sense.
know,
Yeah.
the pressure of insects and predators and this will increase the need to make more crystals to make the insects quit, you know.
Yeah. So if somebody is wants to have these foods in the diet and they go, is there a way to reduce oxalates? Is there a special way of cooking or preparing it? Like some plant toxins, let's say, for instance, lectins. You look at lectins, and there is some research to indicate that, well, if you cook it in a pressure cooker, that you can reduce some of the lectin content, and then it won't be as inflammatory. Is there something like that for oxalates?
Right. It's good to talk about lectins because lectins can be a real problem if you don't cook these things right. If you make beans from scratch, you need to know you should soak them for 3 or 4 days and then use pressure cooking to really kill the lectins because that will just wreck your digestive tract and give you a chance to like become, instead of absorbing 10 or 15% of your oxalates that you eat, you might be absorbing 60 or 70. So you don't even need a high oxalate diet if you've got bowel inflammation. So lectins are important, but you can deal with them if you know what to do. They didn't teach us in Cornell to do that. I didn't know any of that when I graduated from Cornell or UNC with my 2 degrees. So a lot of people aren't aware of that. So I wanted to pause because I feel personally that I damaged myself severely with lectins. So there's oxalate's not the only thing, but when it comes to cooking, heat does not affect oxalic acid or crystals. Not at all. In order to have heat harm crystals of oxalate, you need to be like 400 degrees. You cannot do that on your stove. But you can do that in a forest fire. So you can eat the ashes of trees after forest fire. They're lower in oxalate. But you're not going to do all of that. So heat won't do it. Now, some plants, boiling will leach out some of the soluble oxalic acid into the cooking water and you can throw it away. So we've shown that in broccoli, you can reduce oxalate by at least a third if you boil it for 10 minutes. Now, normal people only boil broccoli for 2 to 3 minutes because past 3 minutes, you have nothing but liquid mush. Which is fine if you can strain it out, but you'll need a fine mesh strainer to save your broccoli. So we don't really know how much comes out in a 3-minute cook or a 2-minute cook because every test is for 10 minutes. And so we pretend we can reduce oxalate by a third or a half by cooking or boiling broccoli and throwing out the water. But honestly, we don't know how much a 2-minute cook will do. And with asparagus, boiling does nothing for it. 10 minutes of boiling asparagus will make it a mush, but it won't change the oxalate content. So it's different with each vegetable. You can't make global statements about boil everything. Most people are not boiling their spinach, their Swiss chard, their beet greens for 10 minutes. They're putting them in blenders and salads and basically keeping them either raw or undercooked. So it's almost irrelevant to the conversation. With something like baking a sweet potato, that doesn't change oxalate content. So it's good to know that boiling broccoli is good. That was grandma's method anyway, and it worked fine, and go ahead and do it. And I would highly recommend that you do that, but you can't universally protect yourself with cooking oxalate
Yeah. Okay.
foods. Yeah.
All right. So then it's just gradual reduction, but it doesn't mean that people have to totally eliminate all their plant foods. It's just
No,
making better choices.
better choice, just being more informed. And that's a hurdle for some people, taking the time to slow down and really learn when we're surrounded by noise, irrelevant, distracting noise that says, plants are great, don't listen to them. They're just scaremongering. No, you got to take some time and learn. I've tried to make it as easy as I can. I have information that's free on my website. There's like 5 charts in my book about what's high and low. And I even have, if you're really into it, I have the data book where you can get the real details of oxalate content in food and really refine what you're doing and get yourself out of what I call the danger zone of a toxic level of consumption. It's not hard to be eating 6, 8, 900 milligrams or even thousands of milligrams, which is quite toxic. Some people with leaky gut, 3,000 milligrams will kill them. They can drop dead, especially if they have a kidney problem. They have weak kidneys and a leaky gut. Somebody like, a bariatric surgery patient, somebody like that, 3 spinach smoothies is enough to kill them. I mean, that is something we ought to know about. And so this will give you like the data and color coded. Some things are almost no oxalate at all, and some things have a lot of oxalate, and I've color coded it so
Okay.
you can see by portion size. It's really about how much you eat. So if you want a low oxalate spinach salad, use 5 spinach leaves or less, and you've got there.
I love your data companion book. It's really nicely laid out, and I like the color coding. It makes it really easy for people, other than just looking at a bunch of black and white numbers. So that's a really great book to use. Yeah, and I've used your charts on a regular basis in my clinic, and getting people to make better choices. And spinach is definitely the number one uh, suspect, if you want to say that. It seems most people, especially with women with thyroid hormonal problems, I always ask them, "Do you eat spinach? Are you doing spinach smoothies or anything like that?" And 90% of the time, it's yes, yes, yes. And when we take them off of that, then they feel great. So it's really fascinating.
Well, isn't it nice to be effective as a clinician and have a simple answer for people?
Yeah, that doesn't involve drugs or surgery, right?
Yeah, or IVs. A lot of integrative medicine clinics are relying on Myers cocktails, vitamin C IVs, and all these things as a way of like healing people. But in fact, vitamin C becomes oxalate in the body. And by sticking it in your veins, you create a lot of inflammation in the vascular system that causes fibrotic vessels and oxalate buildup and can eventually lead to kidney stones later after you stop the treatment, because the same thing happens with the vitamin C, where the body holds on to all the oxalate that's forming in your brain and elsewhere. Because vitamin C is a sneaky Trojan horse way to get oxalate into your brain and other sensitive tissues that would try to not absorb oxalate. They'll absorb vitamin C that will turn within the cells and the tissues into oxalate. And later on, as the body tries to get rid of it, you can literally have a kidney stone on a low oxalate, low vitamin C diet. And you can thank your IV vitamin C treatments for some of that.
And would it make a difference on where the vitamin C is coming from? Sorry, I say vitamin. I'm over here. They're saying vitamin. You're saying vitamin. But is there a difference, let's say, between ascorbic acid based vitamin C and another type?
Nobody's done any real studies to
Right.
confirm that theory. That is very popular online and so on, but chemically, ascorbic acid degenerates no matter where it originally came from or what flavonoids it came with. By itself, hanging around, it will just degenerate into oxalate. It can even occur in the bottle of the supplement itself because there's a non-enzymatic, kind of oxidation to that molecule. It's close enough to oxalic acid, it becomes it. You're not going to protect it with flavonoids, or are there some natural magic? I think that's more of the same logic. If it's natural, it's got to be better. It's got to be good.
Hmm.
Well, whole root turmeric has a lot of oxalate, but curcumin extract has none. So there's certain processing, like learning to soak your beans and use a pressure cooker. That processing turns lectins into something harmless, more or less, mostly harmless. And that's processing is beneficial. That's the technology of our food science that we've evolved for thousands of years. But now we want to say go back to nature and make everything whole and natural. And this is a fallacy. And so to think that your vitamin C is coming from cherries or lemons, that's not a terrible thing. That's a good way to get vitamin C. You need some, but you don't need 8, 10, 12, 100 times what your cells can use.
Yeah.
Extra is just extra. Hanging around can become a problem.
So a thing I found as well is people think you can only get your vitamin C from, let's say, fruits. And I have an interesting chart I use here at the clinic, where it shows 100 grams of blueberries showing 9.7 milligrams of vitamin C, and 100 grams of liver showing 25 milligrams. And people never think, well, my God, there could be vitamin C in proteins and in organ meats and that. So then really people that are on more, I don't want to say carnivore diet, but I find a carnivore diet is probably the ultimate elimination diet. If we want to take out all the irritants, put somebody on a carnivore diet for 30 days and then see how they feel, reintroduce some foods. So would be totally different thing then, right? Because it's already been processed in the food.
Well, it's really, again, it's about getting the body levels that it needs or can handle. Vitamin C is a need, oxalate is a toxin,
Yeah.
but they both need to come at a level you can cope with. And you need some vitamin C, but you don't need a whole bunch more vitamin C unless you're dying of sepsis in the hospital. That's when you need some extra oxidation to help kill off bacteria. But really, it's a pro-oxidant effect that it's having, if it's harming bacteria in the body. And that pro-oxidant effect is bad for the circulatory system, and it's not something you do every day. You do under particular medical need. But the idea of hyper doing vitamin C in a supplement or IV frequently is anathema.
Okay. If if somebody wanted to assess how much oxalate they have in their body or overload, is there any kind of test that somebody can do? Is there a blood or urine organic acid test? Is there anything like that that somebody could do to put maybe a number on it?
We would love to have a number. We're really into that these days instead of like
Y-
just assessing the situation and looking back at the art of it. Unfortunately, it's even hard if you're a cadaver to find out how much oxalate is in your body. You can take slices of your thyroid gland and put it under the microscope and try to see these crystals, which takes real skill to do that. You need the right technique and you need something that's less than 5 hours old. If you've been dead for more than 5 hours, that tissue starts to degenerate in a way where the crystals are no longer visible. So even seeing them in a cadaver tissue is hard to do. The liver, you cannot stain for them, test for them very well at all. They're hidden in these lipid crystals. So for in the living body, you're not going to get into those tendons and bursa and synovial fluids and meninges, the cerebral fluid. You just can't get in there to find out how much is hiding out in there. Just like with heavy metals, you kind of have to do this sort of challenge test to see it coming out. And the challenge test here is to go on a low oxalate diet for 6 months and see in that 6 month period, do you see signs of cloudy urine and skin eruptions and tartar around the teeth and gritty eyes? You see signs of some external release of oxalate. And that's where it's an education. You have to educate yourself to know how much you're eating, how much you were eating, how much you're eating now, and some signs to evaluate how the body is doing. It's not about a blood test. Now, if you do a urine test, like a 24-hour organic acid test, or ask your urologist to do a urine test and check for citrate level and check for oxalate level. If you get a high reading, then that is very much a sign that you have high oxalate in the body. If you get a normal reading or a low reading, that doesn't mean anything because it's going to be variable how much the body is moving oxalate out at any given time, even if you're on a high oxalate diet. And it's more so, sometimes your body is so good at sequestering it, it's trying to protect the kidneys. The kidneys are not constantly awash in oxalate. It's too dangerous for the rest of the body. So you would need 9 urine tests to give you a sense of the average amount of oxalate that you're able to pee
Mm,
out.
okay. And and typically, how long would it take a person to notice improvements when they reduce their oxalates?
On average, within 2 weeks, you can tell that you're feeling better. Sometimes it's just for a few days where you feel great for about 3 or 4 days. Because it takes about 3 days for cells to outfit themselves with a different metabolism that allows them, instead of holding oxalates, to release it. So you get at least a 3-day honeymoon period where you have no symptoms and suddenly like, you don't have as much pain at night, you're sleeping a little better, you're not as crotchety, you're feeling more invigorated about your to-do list. There's a lot of neuro effects to oxalate where you get people are prone to anxiety and depression and overwhelm and even, kind of almost autistic brain or a little ADHD. More of that kind of stuff is happening while you're neuropoisoned. And for a few days, when you stop eating it, the body's still holding on to it. You're not eating it. Suddenly, there's a kind of a moment of mellowness that's lovely. And then it breaks. So if you feel good for a few days and then it breaks, don't think, oh, this isn't working. It was just 3 days of placebo. It's actually a physiological thing where you could start getting into some of that clearing process that's keeping you a little bit poisoned for a while. But generally, that should happen within the first 2 weeks where you notice some improvement in something like your sleep or your mood or your urination, whatever.
Okay. And would there be any cofactors or supplements that somebody could use to assist that process?
Calcium and minerals will support the body in clearing oxalate. So when you start taking more calcium and mineral supplements, that tends to promote the oxalate clearing. So if you have a bad reaction to calcium, that may be a sign that you really need it badly and that the body, once it's getting what it needs, is getting a little bit muscular about, okay, let's clean up this mess. So yeah, calcium's the most important thing. It is the binder. People are looking for binders. We have this concept of binders in the detox mindset. calcium is the binder. Citrate is the breaker. So if you need a stone breaker, you need lemon juice or citric acid supplements because citric acid softens all those stones and makes them more like chalk rather than like quartz. So your two big tools are citric acid and calcium and other minerals. So provide that and be careful because you may need to put back a few bites of dark chocolate with your dinner or some beet juice or something so that you don't get too excited and do that whole crisis thing.
Yeah, yeah, yeah. Yeah, we would use sometimes malic acid from apples as well. So could somebody use apple cider vinegar, or would that be a no-no?
Yeah, the vinegar is acetic acid is not quite as strong as citric acid, but
Yeah.
it's similar in that it also is alkalizing. So part of the benefit is alkalization because the inflammation itself, that inflammation required to deal with oxalate makes you acidic. So as you get into this clearing, you're going to go acid. You're going to release oxalic acid, which is acid that's sucking the calcium, which is an alkalizer, out of your system. So you go acid from multiple angles of this. So the citric acid, the malic acid, the acetic acid, all helpful with this alkalizing because the liver turns citric acid into bicarbonate, basically. But you can use baking soda and calcium. Those are also ways of alkalizing to help kind of control the side effects. Because the side effects of all this include, the neurotoxicity, the acidity, and the mineral loss. So things like mineral baths and taking enough minerals. These are all part of supporting the body and getting yourself back together.
Mm. In this day, there seems to be a big push on plant-based diets. So obviously, we know that a lot of plant-based foods can have a lot of oxalates in there. So how do animal foods and fats help buffer or repair the oxalate-induced damage?
Well, you need enough protein, particularly the branched chain amino acids, to initiate tissue repair and support the rebuilding of bones and muscles. There's a very good chance if you've been on a plant based diet that you have inadequate mineralization in the bones. The bones are probably a little bit brittle, and that's because it's oxalate crystals in them interrupting their structure. So the protein is very helpful in stimulating the body's desire to have stronger bones, better muscles, to maintain muscle mass and bone mass. So that's the most important thing there is that you stay in this kind of rebuilding metabolism as your system is breaking things down. And fat, of course, helps your liver and your gallbladder keep functioning and help you flush out. Fat is kind of like a solvent. You can use a fat to clean another fat, right? And it's a solvent that helps flush out fat-based problems and support the liver and the gallbladder and healing. And of course, there's butyrate and fatty acids that help the brain. With this anxiety and the nerve damage you can have. You need to remyelinate your nervous system and help restore your nervous system, and so you can't do that with just fat, though. You really need the minerals because minerals are what makes the cells work right, particularly calcium. Calcium is number one inside a cell. The cell has to be healthy enough to handle its calcium just so that calcium is doing what it needs to do so you can generate energy and repair tissue.
Very good. So then, for somebody that's still maybe not 100% sure, what would a typical low oxalate diet look like in your view?
Well, you take it how you like to eat now and kind of assess what are my high oxalate foods. Have I been living on quinoa because everyone says it's high protein? Have I been living on almond flour, spinach smoothies, dark green supplements, whatever? Like find out where your diet is high in oxalate and just think about what else you could have instead of that and start substituting out. And it might be like, oh, I love arugula and romaine. That would be fine for my salad. No big deal. Oh, I could use a little squash instead of sweet potatoes. I can do that. Some cauliflower and cabbage family vegetables cooked instead of potato all the time. I could just, some people that have a hard time with their potatoes. Potatoes and tea, especially I think in the British Isles, but also just in Western culture, they're kind of addictive. So if you're hung up on your tea, maybe you could dilute your tea with half rooibos or something else, um, and so that you can lower the oxalate in the tea. But you need a little oxalate in your diet in order to not get into these clearing crises. So you don't have to zero everything out. Just pick one or two things and start thinking substitutions. And your diet doesn't have to be dramatically changed. And you take yourself and your microbiome on this gradual process of evolving your diet into a more oxalate aware way of eating and keep going. Just give yourself time to keep going in that direction.
Yeah, great. And how can people tell if they're experiencing oxalated related issues versus other forms of inflammation or toxicity?
Well, I'd say mostly you can tell because you get this outward sign of oxalate clearing eventually. And that's pretty convincing. I'm surprised at how many people come to me and said, oxalate, my depression was oxalate all along. My
Yeah.
anxiety was oxalate all along. Like, and what? Why are you telling me this? Really? I mean, people have had to convince me about all these conditions that oxalate cause because I was like, yeah, it's arthritis and it's this and that, but it's could be anything. And so you need to be able to see this cycling in and out of your symptom pattern. With oxalate, it tends to cycle in and out. It tends to be worse at night or in the morning after because it tends to inflame at night as the body's kind of trying to deal with oxalate. But in truth, you can't always know. I think what's important to know is that the kind of damage that oxalate causes will keep any disease process in place, and you will not recover from any disease process, any surgery, your scar tissue won't properly resolve. None of that if you're eating a high oxalate diet. So, high oxalate eating will get in the way of your life goals to be happy, whole, active, independent, and optimized, and so on, regardless of whether it's the primary cause or just the thing that's preventing you from being awesome like you want to be.
Very good. Just a couple more questions for you. So, what's your vision for how public health and nutrition education could evolve if we understood oxalates better?
Oh, this is my dream to affect public health and nutrition. This is really the point of my work. We could do some tweaking with our recommendations. In public health, we say eat dark leafy greens as often as you can. Well, that's really not a great idea because there's three of the dark leafy greens that are a problem. And we should say that spinach, Swiss chard, and beet greens should be eaten occasionally and cautiously in moderate portions and should not be used as a routine staple food. That should be number one. And clinics need to recognize that people who are very sick, frail, young children, elderly people, people about to have surgery, people recovering from an accident should be protected from high oxalate foods. And that means not giving people, chocolate covered nuts on all the time and potato products and so on. So basic things like that, recognizing that nuts and so on are not meant to be staples for humans. We've never had a history where we had so much machinery and industrial processes to make it possible to eat handfuls of nuts on a routine basis. Back in the day when you had to like shake the tree yourself and stomp on those nuts yourself and pull out the nut meats yourself and do something with them to make them edible, you just didn't have the patience to be eating. It just didn't happen. So we're doing experiments now, eating things like peanuts, which were never human food until 100 years ago. If nutrition would just admit that these novel foods can be problematic, that there are natural toxins in plants, and the plants should be known better. We should be studying them more. We should admit that we haven't really taken the plant toxins seriously and how it's really affecting our growth patterns, our functional patterns, our performance in sports, our ability to recover from an injury, and our aging. And this is a big thing. Truly becoming aware of plants' toxins, particularly oxalate, which is the one you can't cook out and you really can't deal with other than to control your consumption. If you did that, you will have found the root of the fountain of youth. This is the best we're going to be able to do is to avoid hurting ourselves. Not that we can like force the body through biohacking and optimization to be something superhuman. What we need to do is stop getting out of our own way or get out of our own way and stop preventing our full expression of all we're capable of, both in terms of growth and performance, but also how well we can maintain ourselves and our independence all through the late years of our lives.
Yeah. Often I like what you said there. It's generally not what we should be adding in. It's more what can I take out? And it's so simple that sometimes it just goes over people's heads, doesn't it?
It does. Too simple. It's hard to make money on it. You can't like sell much. So it's not going to be popular because it's how do you make a living these days with things so expensive and medicine with the amount of education it takes to be really good in medicine? how do you make the kind of living you expect to make with all that effort if you have nothing to offer other than say, let's talk about what you put in your salad?
Yeah. 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 So, well, hopefully we keep pushing, things will change. And I think they are bit by bit. People are definitely becoming more aware. So let's hope that that wave continues. So Sally, where can people?
I'm very confident that people like yourself who are willing to like change their minds is so obvious. And the sharing with your clients and patients, like they are saying, wow, my doctor recommended this is actually working. It just becomes truth. 100 monkey, it's just is truth. Truth is going to prevail. I don't have any anxiety about that because it is so profound how much this can help people that the love of plant foods will become obviously a problem if we continue to share truth. So I thank you for helping with that process.
Well, thank you to you for helping us with the information to do that. So that's fantastic. So talking about information, Sally, where can people find your book, connect with your work, learn more about lowering oxalates safely?
Well, please come to my website because that's the only place you're going to find the data companion you said that's helping you. This is not necessary to get. Some people do like it though. They think somehow it's a quicker way to get into the topic because they get the food numbers right away and they start with learning the foods. But you can learn that from Toxic Superfoods, which is available anywhere books are sold now in 8 languages around the world. So number one, come to my website because not only can you get the data companion, there's a cookbook. I'm coming out with a new edition of that in early December. And there's the beginner's guide, which you can download as a PDF. If you're a clinician, you can order a plastic paper version that is a really nice handout for your clients and bookmarks with oxalate lists. So there's tools there on my website, which is sallyknorton.com.
Excellent. Well, Sally, thank you for joining me today. It's been such an eye-opening conversation. Your work is really a powerful reminder that even the healthiest intentions can sometimes backfire when we don't understand the deeper biochemistries of our food. So, for those listening, if this discussion resonated with you, I highly recommend Sally's book right here, Toxic Superfoods. Incredible resource for anyone dealing with unexplained fatigue, joint pain, inflammation, or just wanting to understand why clean eating doesn't always equate better health. So you can learn more about Sally's work on her website, just like she said, sallynorton.com. We'll make
Sally
sure that
K.
we, sorry,
It's Sally K. Norton. Yeah,
SallyKNorton.com. I'm sorry,
there
Sally
is a
K.
SallyNorton.com. That's somebody else with a K
Right, we
kind
don't
of.
want that. SallyKNorton.com. We'll put all of Sally's links into the show notes as well, so it'll be easy. Just have to click on it and all her media links and all of that. So, Sally, I'd like to thank you once again. This has been a really great conversation. And thank you to all our listeners as well for tuning in. And please share this with somebody that may benefit from that. And we'll see you on the next episode of the Integrative Continuum. Take care and have a great day. Thank you for joining me on the Integrative Continuum. I hope today's conversation gave you new insights and practical tools for your own health journey. If you enjoyed this episode, please subscribe, share it with someone who would benefit, and leave us a review. It helps us spread this message further. Until next time, I'm Dr. Richard Rocker. Stay curious, stay empowered, and keep moving forward on your path to integrative health.